YouTube and good day world. So it's John here again and welcome to my YouTube channel. For those who are new to this channel, you're very much welcome. So guys, in our last video, we had 9 tips on preparing and passing the Philippine Nursing Licensure Examination or the PNLE. Our focus was the pre-board examination or the time before you took the exam. And in this video, we're going to carry on with our part 2. So I'll give you 7 more tips during the intra-board exam or the actual day of your nursing licensure examination. Before I start, I'd like to thank our frontliners for their endless efforts in saving people's lives against COVID-19. I'd like to take this opportunity as well to greet my family and friends, DKs, TCG, and colleagues, as well as my colleagues. I hope you're all doing well today. So without further ado, let's crack on. Tip number 1, eat. So guys, this is it. It's your examination day and be sure to have something to eat for your brain to have fuel. Guys, I suggest eating in moderation because eating less would make you hungry while eating too much might make you drowsy during the exam because the oxygen would go to your stomach and your brain needs that oxygen for you to think well and choose the best answer during your exam. Since rice is a staple food for us Filipinos, yes, you may eat a rice meal, but don't overeat, okay? Let's go to our second tip. Tip number 2, attract positive energy. Guys, on your examination day, you want positivity or optimism, positive vibes. Claim that you're going to pass the exam or higher, raise the bar, claim you're going to top the board exam, okay? Believe in yourself, no one else can do it but you, alright? Remember that you have to focus on your test really well for you to be able to choose the right answer. And the more correct answers, the higher chances of winning. Now guys, let's move on to tackling the board exam questions. Tip number 3, patient safety and prioritization are key. The nursing licensure examination, whether Philippine-based or overseas, center on patient safety. Part of it is to ensure that nurses will be able to deliver not only professional, high quality, and high standard holistic nursing care, but also safe nursing care to all patients across the lifespan. Remember to think about patient safety when you're answering the PNLE questions. So let's talk about patient safety and prioritization in this sample question. Sample question number 1. You are caring for a patient with an ongoing packed RBC or PRBC transfusion when suddenly the patient develops shortness of breath, flushed skin, and chills. So guys, we've got 4 options. A. Administer oxygen. B. Place the client on drop light. C. Check the client's temperature. And D. Stop the transfusion. Guys, we're talking about patient safety here. In option A, this may address shortness of breath, the administration of oxygen, and then letter B and C, placing client on drop light and checking the temperature, may address the chills. But utilizing your nursing knowledge, you know that transfusion reaction is one of the common complications of blood transfusion. Thus, you would want to stop the probable cause of this reaction. Therefore, the best answer to this question is option D. Stop the transfusion. Now let's go to another sample question. Sample question number 2. A patient with low hemoglobin and hematocrit levels has been prescribed with packed red blood cells or PRBC. Prior to hanging the blood transfusion, the nurse takes the client's temperature and records 100.8 Fahrenheit. Which action should the nurse take? You've got 4 choices in this question. Letter A, give an antipyretic and begin the transfusion. B, proceed with the transfusion. C, administer an antihistamine and begin the transfusion. And D, delay hanging the blood and notify the physician. Again, the question is about blood transfusion and an identified issue is the temperature of 100.8 Fahrenheit. Converting the temperature into Celsius, it would be 38.2 Celsius or 38.2 degrees Celsius, which indicates pyrexia. So guys, let's explore the options. Options A and C, which are giving antipyretics and antihistamines, would require a prescription from the medical doctors or the physician, while option B reflects the decision to administer the blood, which is quite outside the scope of the nursing practice. So the best thing to do in this scenario is to hold the transfusion, inform your charge nurse, and then the doctor, as this action would also prevent any untoward reactions to the patient. Therefore, the best option to this question is letter D. Tip number 4, remember chain of command. You might encounter questions that center on chain of command during your exam. The principle is that you should always go up the chain of command, and that's to your supervisor, whether it's your head nurse, the charge nurse or nurse in charge, or your direct supervisor or nursing supervisor. So we've got a sample question regarding chain of command. So you've got sample question number 3. You are working on the surgical unit and received a call from the operating room to administer a preoperative medication to a surgical patient. You then discover that a surgical consent form has not been signed after giving the prescribed medication. Which of the following actions should you take next? A. Call the physician. B. Transfer the patient to the operating room. C. Call the operating room and inform them that the surgery must be cancelled. And D. Inform your nursing supervisor. Let's explore the options. Option A is escalation, which is appropriate as well, but the principle is always go up to your supervisor first. In letter B, it would be considered unsafe practice as the patient has not signed the consent form. Therefore, it's inappropriate to transfer the patient to the operating room without the signed consent form. And then letter C, calling off the surgery would be more appropriate for the doctor if the surgery really needs to be cancelled. Therefore, we've got letter D, inform your nursing supervisor, as the correct answer. Moving on to tip number 5. Tip number 5, beware of words or phrases like except or all but one. All but one is a tricky question in your licensure exam. In this phrase, the word but means except. So when you see a question that asks all but one are appropriate nursing actions during nasogastric tube insertion, it simply means all except one are appropriate nursing actions during the nasogastric tube insertion. Let's have a look at this example. Sample question number 4. The nurse is caring for a patient who's got a tracheostomy. All but one should be done by the nurse each time he provides a tracheostomy care. Letter A. Apply oxygen source loosely if the oxygen saturation increases during the procedure. B. Observe surgical asepsis when removing and cleaning the inner cannula. C. Clean outer surfaces in a circular motion from the stomach outward. And letter D. Cut a slit in gauze square to place under the tube holder. Let's go to option A. It's a good practice because we must be prepared to provide supplemental oxygen should the patient desaturate during the procedure. Option B is also appropriate as it's correct to observe surgical asepsis during the procedure as it minimizes the risk of infection in the tracheostomy or the trachea. Option C is also appropriate as the outward motion in cleaning the stomach prevents introduction of microorganisms. And option D, cutting the gauze squares can lead to loosened lint and fibers which may lead to aspiration, thus causing harm to the patient. Thus, the best answer to this question is letter D. Tip number 6, manage your time well. So don't overanalyze. Too much analysis causes paralysis. Also, you may consider transferring the answers you're sure of from the questionnaire onto the answer sheet and then just go back to the unsure items later to maximize your time. Okay, let's move on to tip number 7. Tip number 7, eliminate. The process of elimination boosts your chances of winning, or the chances of scoring higher in your board exam. For example, a test question has got 4 items and you manage to eliminate one. That means you've just increased the probability of hitting the right answer by 25%. But then again, if you really don't know what to answer, just pick letter C. Technique, letter C. Okay, let's apply the process of elimination in this sample question. Sample question number 5. You are looking after a patient with hypertension and the patient asks you which factors can cause blood pressure to drop to normal levels. The nurse will base his response on which of the following: A. Kidneys excretion to sodium only. B. Kidneys retention of sodium and water. C. Kidneys excretion of sodium and water. And D. Kidneys retention of sodium and excretion of water. So this question is about hypertension, and we should highlight that it's talking about factors that lower blood pressure. Going back to our anatomy and physiology days, we've learned that kidneys excrete sodium and water together, therefore reducing fluid volume in the body, thus reducing the blood pressure. So let's explore the options. In letter A, you've got the word excretion of sodium only. The word excretion is correct, but the word only after sodium is a bit questionable. Let's go to letter B. In letter B, the word retention is obviously wrong. Therefore, we can eliminate letter B. In letter C, you've got the words excretion, sodium, and water, which is appropriate. So we'll consider letter C. As for letter D, you've got the word retention, making it disqualified as the best answer. So we'll eliminate option D as well. Utilizing our knowledge in anatomy and physiology, we know that sodium and water go together. Thus, we eliminate option A. Therefore, letter C is the best answer. In this example, remember this concept: water follows salt, or wherever salt goes, water follows. So guys, this ends part 2 of our tips, ideas, and strategies on passing the Philippine Nursing Licensure examination. I hope these tips would not only help you with your PNLE, but also with your other examinations in the future as well. If you like the content of this video, feel free to click on the like button and subscribe to my channel, and also hit the bell icon for you to be able to access more videos in the future. Also, let's connect on Facebook. My Facebook page is John Mendoza and my Instagram username is Ariel Acer. Guys, thank you very much for watching and I'll see you soon. Goodbye!